words you never want to hear. You have cancer. But then your doctor informs you, we're going to enroll you in Cancer University today. My cancer story goes back many years. I was 22 years old when I got custody of my then 8-year-old sister, Adrienne. I raised Adrienne all through my 20s until one day an ER doctor changed our lives forever when he said she has tumors in her liver and lungs. As my sister's only parent and legal guardian, I had to make major decisions about her treatment 48 hours after receiving that news. And even though I was an educated 28-year-old, I didn't know what to do. I was completely overwhelmed. I often wonder how different the outcome might have been if that doctor had said, "Don't worry, we're going to enroll you in Cancer University today." Welcome to Cancer University, or as we like to call it, Cancer U. My name is Andrea Wilson Woods, and I'm the CEO and co-founder. Cancer U is an online membership platform for both cancer patients and caregivers to educate, empower, and engage them to become advocates for their cancer care, to improve outcomes, and reduce cost. And this is how Cancer U works. We designed it just like an online university, so we start with orientation. Our flagship course, The Proactive Patient, serves as a broad overview to the world of cancer. Upon completion of The Proactive Patient, members go on to take their major courses, which are based on their or their loved one's type of cancer. So for my sister, it would have been liver cancer. Our core courses are recommended for all patients and caregivers, regardless of cancer type. We have weekly and monthly coaching calls. Members are part of our Cancer U Thriver community, which is our online HIPAA-compliant forum where they interact with each other and get support. And we have electives that we create with our B2B partners, and they include workshops, live webinars, trainings, and more. Speaking of B2B, that is our business model, with the majority of our revenue coming from payers, employer health plans, hospitals, and pharmaceutical companies. Our goal is that Cancer U will always be free for patients and caregivers. Through our beta testing and social media marketing, we have traction in these states. We are discussing a pilot program with University of Alabama, Birmingham, and also with Blue Cross Blue Shield of Alabama. However, our big audacious goal is to enroll every patient and caregiver in the country, because 2/3 of Americans will experience cancer in their lifetime, either as a patient or as a caregiver. To drill down on those multiple customer segments, they include over 50 pharmaceutical companies, 64 NCI centers, 1,500 community oncology practices, and 900 health insurance companies, for a total addressable market of $10 billion. Our founding team includes people with startup, financial, B2B sales, healthcare, and technical development experience. As for me, I've been in the cancer space for over 18 years as the founder and president of a nonprofit dedicated to liver cancer, and this slide is just a small sample of the numerous organizations I've worked with. We are raising a seed round of $2 million, which will give us a runway of 24 months. We have a verbal commitment of $500,000 contingent on finding a lead investor or investors with experience in healthcare and tech. As for my sister Adrienne, her cancer journey lasted 147 days. Despite my college education, despite growing up around doctors and hospitals because our mother was a nurse, and despite having contacts at NCI centers even back then, I didn't know a clinical trial was the best option for Adrienne from day one. And by the time clinical trials were discussed, 4 rounds of chemotherapy had decimated her immune system. Adrienne died on October 9th, 2001. She was 15.5 years old. With your help, we can make Cancer U available for millions of patients and caregivers from the moment they hear you have cancer.
Thank you so much, Andrea. Great presentation. Thank you so much for sharing Adrienne's story. Was really, really impactful. Can you tell us a little bit about the space? Who are your competitors in this space? How are you different? Give us a sense of the landscape.
Sure. So our differentiating factors are that no one else has this holistic university style model that combines coaching, community, and courses. We are narrowly focused on cancer, where some of our competitors are much broader. We include caregivers. Many of our competitors do not, and our business is highly scalable. One of our biggest competitors is Belong.life. They focus on the community aspect only. They started broadly, then they narrowed in on oncology, and now they are broad again. They have raised about $14 million, and they sell to pharmaceutical companies and also to providers.
And it seems like your content is something that you're really strong in. Can you talk to us a little bit about how you create that and the strategy behind content?
Absolutely. For our pre-recorded content, we have 3 steps. The first step is we have outside medical contractors that we want to bring in as employees eventually. Step number 2, that content then goes to our patient and caregiver advocate board for that personal insight. And step number 3, it then goes to our medical advisory board for that sign off. However, we are really clear at all times that we are not providing medical advice.
Got it. Um, and congrats on the traction and the raise. For the investors on the line, which I know there are a lot, talk to us a little bit about use of proceeds, how you plan to use that $2 million.
Yeah, absolutely. So the way we plan to use it is we want to develop our proprietary software. We want to increase our content library to over 500 courses over a 2-year period of time. We want to be able to translate our courses and community into Spanish. That has been a priority from day one that providers have asked for, and also to create a mobile app if that makes sense.